Hello and welcome to the Rare Voices podcast. I'm Mark Rowland, and in this episode we'll be talking about navigating the healthcare system.
Just trust me, don't panic. It's normal for me. And they panicked.
Now it's been 4 years since my diagnosis, and I feel I have a very good relationship with my doctors as well.
My confidence has grown gradually over time, and I now feel, much more empowered to advocate in a kind of hospital situation.
When conditions are rare, even healthcare professionals fail to recognise them. This episode discusses some of the struggles that people living with disorders affecting the blood or bone marrow can experience when trying to get medical care. I'm joined again by Julia Wagstaff, whose daughter is being treated for Shwachman Diamond Syndrome, Virginia Patelli, who lives with Paroxysmal Nocturnal Haemoglobinuria, and Cameron Couch, who also lives with Shwachman Diamond Syndrome. Hello, everyone.
Hello, Mark.
Hello.
Let's start by taking the temperature in the room. How difficult is it for you to deal with the healthcare system?
Historically, I think it's been pretty difficult, particularly in the early days, and it can still fluctuate now, really, depending on if you're in a new hospital or dealing with a new clinician. But I think my confidence has grown gradually over time, and I now feel, much more empowered to advocate in a kind of hospital situation or a medical situation.
Well, I think, as PNH patients, we are quite lucky because we have the PNH National Service, which is renowned worldwide for the expertise in managing patients with PNH. And having those specialists looking after us, it's very good. It's great to have that kind of care and being able to go to regular visits and having a specialist clinical nurse looking after you. It's really key.
Cameron, what's it like for you?
My experience is very similar to Julia's. In the early stages, it was quite tricky. And it was quite tricky for my parents to be almost taken seriously because I hadn't been diagnosed then. So I was jumping around from hospital to hospital. They saw scarring on my liver tissue and just went with that, and they didn't really look at anything else. But since I've been diagnosed with SDS, the healthcare, I feel, has been a lot more attentive to my needs. There are still, every now and then, you do experience difficulties when it comes to application, but I think it has definitely improved, even though it may be only slightly. It has definitely shown improvement.
Right. So did you all have a moment when you kind of found your voice when dealing with healthcare professionals? If so, what was it? Can I start with you, Julia?
Yeah, a definite moment happened really for me last year when my daughter became unwell last winter. She was admitted several times into hospital and then sent home again. They thought she'd had just a rhinovirus, which is one of the causes of the common cold. But she wasn't breathing properly. She became really unwell. She was unable to lie down. And they did quite a few different tests, but they failed to spot the problem, which turned out to be pneumonia. And she ended up with a whiteout of one lung. So having gone through that experience, I definitely feel more empowered now to speak up more and to ask more questions and to ask for second opinions and to just be quietly insistent that my voice is heard, because I know my own child. I'm the expert really on my own child. Even though the medical professionals are experts in their field, no one knows my child like I do.
Cameron, obviously you have the same condition as Julia's daughter. Does that all ring a bell to you? Does that sound quite familiar?
Yeah, absolutely. A story that jumps out to me with this similar thing for avocation is about 2 years ago now, I went to A&E because I thought I had tonsillitis, and because we have low neutrophils, that was a bit of a worry for me because, I kind of need that. And when I went in, I warned or just advised the healthcare professionals and the nurses. I just calmly said, when you take my bloods, you're probably going to see I have low neutrophils. Just trust me, don't panic. It's normal for me. And they panicked, which was a bit of a wake up to me that it's easy for sometimes like for the patient to be overlooked in a way. But it's like Julia said with her daughter, like she knows her daughter better than anyone else, and I know my body and my condition better than most people do, even most healthcare professionals. So I can understand where they're coming from because they've spent years and years training themselves to be in that position to care for someone. But at the same time, it's just a willingness to listen to a patient and their needs. But it was quite tricky to get around that situation, but I got there in the end. So yeah, it was a bit of a struggle, but it worked out.
Virginia, is that similar for you, or do you have a different experience?
For me, I think the first time that I felt I needed to advocate for myself was when I also had the first episode of severe hemolysis. And it was a Friday night. I had to go to the A&E, and I realized that obviously it wasn't possible to reach my own doctors. So when you get to the A&E and you might have high fever, you might have pain, it's very important to clearly state what your condition is, what are your needs, and what they have to look after, basically. And it's also very important, I now realize that, to have your patient card with you because it's easier to talk through the details of your condition with doctors, which might not be as easy when you're not feeling well. So yeah, I think that was the one time when I learned how to advocate for myself.
Obviously, on the flip side, there are healthcare professionals that have listened and provided support. So how do you, I mean, you've probably got an instinct for this now. How do you identify potential allies when you are dealing with the healthcare system?
I think my allies in the healthcare system are for sure identified in the PNH National Service, as I mentioned before. My clinical nurse specialist is absolutely brilliant. I have to say I have her email. I email her quite a lot, and she's very responsive. She's very helpful. And I think now, I was diagnosed in 2020. Now it's been 4 years since my diagnosis, and I feel I have a very good relationship with my doctors as well. So I think I feel free to ask all the silly questions that I have, because there are no silly questions, and to raise my doubts and talk through all the things that matter to me with my doctors, and they're always very happy to explain, to have a think with me about things that are going well, things that are not going so well. So yeah, I think the PNH National Service has definitely been very good to me.
I would say that we've been signposted towards specialists in the SDS field by SDS UK, our charity. That's how we found out about specialist care for our daughter down in Great Ormond Street Hospital, and she goes there annually to be, checked over, and she has a multidisciplinary team. Every year we go down to London and we meet the lead SDS clinician, I suppose, Dr. Kergelmeyer, and there'll be a haematology expert there. There's often a psychologist there, and we have a dietary person as well. So Lara's getting, they're all getting a picture of how Lara is from all those different angles. And we were put in touch with that from by SDS UK.
I think it would be a similar case in Julia's story, because we're part of the same charity. I got referred to the SDS specialist in Addenbrooke's, Cambridge, and like Julia's daughter, I'm seen annually. Actually, no, 6 months. Every 6 months, I go down to the hospital in person to have a consult with them, and I have my bloods taken every 2 or 3 months, and they're sent down to Addenbrooke's for further monitoring. So I think when it comes to finding, that was the biggest ally I've definitely found throughout my whole journey throughout the healthcare system. It's just SDS UK and the support they provided, because they also have, as Julia said, dietitians, psychologists, hematologists, just there to help get an understanding of how you work, and they have the best understanding of your needs. And they're always a point of contact when it comes to whether we have questions, whether it's our local GP or in a different hospital for whatever reason. So yeah, they have been a massive ally.
Great. I mean, obviously healthcare professionals can be great allies. They can be, if they're not listening, a great source of frustration. So what do you do now to make sure you're being listened to when you're dealing with the healthcare system?
I think knowing that your voice is really important and that you need to be heard realizing that is really, really powerful. That you are the expert. Well, you are an expert and perhaps the expert on your own condition or your child's condition in my case. I think it's about politely persisting. It's about making sure that your voice is heard. Keep insisting if you're not happy about something. Keep asking. Ask somebody different if that person isn't listening. You know, hospitals are busy. The NHS is stretched. Things get missed. Things get overlooked. Things don't get passed on. And through no fault of anybody in particular, it's just the way it is. So I'd say trust your instincts, act on them, and just keep knocking on the door if nobody's listening.
Yeah, for me, what I always try to do is prepare a list of things that I'd like to discuss with my doctors anytime I have, a regular check, an appointment at the hospital with them. And that really helps me remembering what I need really to talk about and figure out and to kind of get the answers that I need. And I think a few suggestions I will say, to a friend with the same condition is don't be scared to ask the silly questions, because there are no silly questions, and have your patient card with you at all times, especially if you're not talking to your PNH specialist. And, you're your own expert in your own way about your disease. So always try to be proactive, when you're talking to your GP, when you're talking to your specialist doctor, and try to be proactive in sharing those information that, are important to you.
Yeah, I would echo what you said about going to appointments prepared, making sure you have all your sort of pulled information from the different sources, get it in one place and be ready to kind of hit them with the questions or, update them on things that they might not know about.
Thing I do sometimes when I'm being seen by someone new, or actually if it's even going into A&E, I use keywords to be seen a little bit quicker, such as I'm immunosuppressed, I have very no neutrophils. I have SDS, which sometimes works. And once I go into detail what it can cause, I can be seen quite well. I have pancreatic issues, things like that. If you just use keywords sometimes, that can help you be seen a bit sooner. And also it can almost echo to the healthcare professionals, okay, this person actually knows what a neutrophil is. Maybe they actually know what they're talking about. I found that's worked for me in the past as well.
Any other final thoughts from you guys?
I might have touched on this in episode 3, but I just want to say to most of all the listeners, it can be stressful to navigate the National Health Service, the life in general, but just know your life is just as valuable as everyone else's. This condition shouldn't define who you are, and you deserve to live a life that you want.
Yeah, that's a really hopeful note. It's clear that all three of you have found a way to sort of navigate it, which I think will really help people. So thank you so much for sharing your experiences.
Thank you for having us.
In the next and final Rare Voices podcast for this series, we'll be asking, how do we raise awareness of rare conditions? Be sure to subscribe on your favourite podcast platform so you never miss an episode. And visit super-rare.org/podcasts to leave your feedback and help us make more episodes in the future. You'll find that link in the show notes. This podcast is brought to you by the Better Together for Healthy Bone Marrow Alliance, incorporating the Aplastic Anemia Trust, Congenital Anemia Network, DC Action, Fanconi Hope, PNH Support, and SDS UK. It is funded by the National Lottery Community Fund.